Hello and good afternoon, everybody. I'm Dr. Kedar Tilve. I'm a consultant psychiatrist with the Department of Mental Health and Behavioral Sciences. Um, it's wonderful to have a talk with you guys and to do this on the occasion of Holi. So, happy Holi, everyone. The reason we are having this conversation is because it has been a very, very important week. If you have not yet received the messages, let me just remind you this was perhaps the last week of what was the old normal, all those years back, 2 years back to be exact. We were heading into a situation which was going to test us to the limits, which was going to decide how we responded as professionals, as people. It was going to test our humanity, it was going to test our patience, it was going to test our resilience to the highest extent possible. So, like I said, I'm Dr. Kedar Tilve. I'm a consultant psychiatrist, and it's my privilege today to be talking to you guys, all essential healthcare workers, as a part of the Patient Safety Week initiative, and just say thank you to each and every one of you, and have some amount of gratitude for what we have gone through, what we have experienced, and the fact that we are having this conversation today. Uh, as a rule, because we are healthcare workers, because we work in hospitals, we have endured what many people tend to describe as the front line for uh, battle of the pandemic, which has raged on for 2 years and might still rage on for a bit more. We don't know honestly. But if we have made it through 2 years, if we are hearing this talk, if we are having this conversation, if you're listening to me right now, here's an heartfelt thank you to each and every one of you. Here's acknowledgement to each and every one of us that we have made it through 2 years, and we made it through 2 years for which the books had really not prepared us, for which there was really no protocol in place except for what we understood, what we learned from experience, and what we responded to as we went along. So, we're going to talk about mental health at work. We're going to try and keep this as short and sweet as possible because, quite simply, in the past 2 years, if there has been a group of people who has demonstrated time and again the resilience, the empathy, the humanity, and uh, the fortitude and the grit that is necessary to tide over the pandemic like we faced. It has been healthcare workers. It has been essential healthcare providers. So let's start today's talk of mental health at work with one simple understanding, and that is that as we went along, we realized that yes, it was important to be a nursing staff. It was important that we had our doctors and we have the regular hospital staff monitoring, coming to the hospital regularly. But essential healthcare service providers were also necessarily people who were not usually acknowledged, but nonetheless, in the past 2 years, every single healthcare worker will tell you that they were essential to the cause. And to name a few um, that that come across are all those people who ensured that we could have the software running, that our networks weren't down, that we had the Zoom meetings, the IT guys, the marketing and managing teams, which ensured that we had a point of reference, that in spite of everything that we went through in the past 2 years, we as a group, as a network of hospitals, uh, could communicate with each other, could talk with each other, were aware of what was happening, to all those managing teams, to all those marketing teams who helped us through, to every single person in the reception who smiled at us in if it was the first 3 4 scary months, or the second wave or the third wave. But never once that I came into this hospital, uh, any of the hospitals in fact, at any point of time, did I feel out of place, did I feel like we were battling against a horde. This is basically because every single one from every single team turned up. So when we talk about healthcare workers, let's acknowledge the fact that there have been other people too who have been there to ensure that we have had a smooth transition, that we have been able to connect with people better. We have been able to coalesce better because of the unseen help that we have received all through this. And let's just acknowledge the group and the team which has made it possible. Now that said, I'm talking to you today because of one specific concern which has been brought to the fore in the past 2 years. And that is that mind is pretty much a part of the body. And your ability to combat an illness, to combat an unforeseen social circumstance, to combat an adversity is essentially going to be dependent on the resilience, the psychological resilience that you have. We're having this talk today because we have realized and we have seen this happen over and over again, that as a frontline healthcare providers, we have been exposed to the burnt of the stress that we have endured during the pandemic. Uh, Initially, there was a mild stigma, then there was overwork, there was sheer physical exhaustion that people went through, there was extra amount of work shift scheduling issues, there were a lot of extra amount of duties that we had to transition through. uh, there was also a lot of times when we felt isolated, when we felt alone, and most of us have at some point or the other gone through phases of burnout, emotional blunting, social isolation, emotional exhaustion, um, even emotional distancing, because uh, we have not been, cut away from the fact that in spite of being health workers, we have had to abide by pandemic norms. How do you explain to families, how do you explain to children that you can't be there for them because you are required to go to an hospital? How do you reassure your elderly, how do you reassure your parents, 60, 70, 80-year-old parents, that you have to go there and you have to work and you are doing everything that you can to take care of yourself and keep yourself safe? How do you ensure that your kids come back to, um, well, honestly, online schooling, and how do they keep in touch with the uh, day-to-day requirements when they're not going to school? How do you cope up with a support system which is already taxed, and then if you are a healthcare worker, it's an additional thing. So we are talking about mental health at work when it comes to healthcare, and we are talking about this because honestly, we have realized that it makes a difference, and we have realized that each and every one of us will be going through some sort of stress or the other. This is not the first time that we've had this conversation. We've had this conversation a couple of years back too. We've had this conversation last year. But the if we don't learn to acknowledge the stresses that we face, if we don't learn to acknowledge the anxiety that we face, we are going to have difficulty identifying it, and we are going to have difficulty processing it. And more often than not, we'll be left alone to fight with it when you don't have to. We have got through this pandemic as a group, we have got through this pandemic as a team, and moving forward, you have to remember that you are still very much a part of this team, that there is still pretty much help available, And so I'll try and touch upon the resources that you can reach out to. What are the simple methods that you can actually deal with stress, and we'll talk about that. But before that, let's just identify what signs are there that we need to be aware of. You all know that sadness of mood, depressive features. You all know that ideas of helplessness, hopelessness, worthlessness, ideas of guilt, worries about the future, nihilistic ideas of self. These are signs of depressive spectrum. The decreased interest in previously pleasurable activities. All of us have by now been become pretty aware of the fact that anxiety features such as palpitations, trembling, just an anticipatory anxiety of getting to work, of feeling extremely anxious in the morning, which resolves by the evening time, of just pure and simple panic attacks that we may experience from time to time, are signs of anxiety. So signs of depression and anxiety are known to all of you. uh, there is also subtle signs which I need to point out today, because this is something that we don't usually talk about. And these include irritability on minimal provocation, intolerance to loud noises. We are all healthcare workers, so we are usually used to the beeping of the monitors. But if you feel that the beeping of the monitors, or the siren of an ambulance, or just uh, just an overtly loud speaker is getting to you, is making you irritable, then perhaps you need to have a conversation with your supervisor, with your friend, with your local mental health practitioner. um, we have psychologists in every hospital, so you need to have a conversation with them, because these are the subtle signs which we tend to miss. And it is, again I repeat it, it is uh, decreased tolerance to loud noises and irritability on minimal provocation. If something which would not normally anger you gets you seething with rage, gets you frustrated, if you find your patience levels dropping, well, these are again signs of stress increasing, and these are signs of burnout that we have to be careful about. uh, why am I alluding to these signs? Well, because these are the subtle signs, these are the first indicators. The depressive and the anxiety features are obvious. You will notice it not only amongst yourself, you will also notice it in your, friends and colleagues. Once depression and anxiety starts, the book says that it's not only noticeable to the patient, it's also noticeable to people around you. So that's something that we need to be careful about. But the first signs usually are irritability on medication, decreased interest in previously pleasurable activities, and intolerance to loud noises. There is also the usual sleep disturbances. I mean, we all know this, and we all notice this. But if your sleep disturbances persist beyond 1 to 2 weeks, in spite of trying sleep hygiene activities that I know most of you are aware of and practicing, well, then that's a cause of concern. Um, there is also a very, very subtle sign which points to chronic stress, and points to a little bit of a burnout like symptom developing, and that is decreased motivation. If you find yourself uh, not wanting to perform to the best of your abilities, if you find yourself not caring about your patients as much as earlier, or you find yourself being blunted emotionally about um, normally the circumstances which would cause you to become extremely worried and extremely anxious and extremely caring about the patient, well, that emotional blunting, that decreased motivation could be a sign of burnout. And that is something that we need to learn to acknowledge as one of the signs that we perhaps need to take a look within and figure out the reason why we are doing this. Now, the reason that I'm having this conversation, the reason telling you this now, is not because of the fact that um, we've never had this. It is that we know that when the stress levels are high, you can experience burnout symptoms. And as a group, I know for a fact that we have a um, counseling psychologist, we have psychiatrists, we have clinical psychologists at every unit that is there. So if you feel like you can't reach out to others and can't talk about it, come talk about it with the department, come talk about it with us, and we'll try and answer most of your queries. The best we can tell you is that look, this is a normal routine, and this is the sleep hygiene practices that you can follow, that you need to implement, and you would be able to do it. But if you don't act on the decreased motivation, if you don't act on that emotional blunting that you are experiencing, then this will give way to a burnout. This will give way to an existential crisis in many. This will sometimes give way to a frank breakdown in some. um, Not to mention the fact that it could lead to faulty coping mechanisms, it could lead to increase in substance abuse, it could lead to increase in nicotine use, in alcohol use, and that is not going to be good for your health. That's a fact. uh, we have to be careful of all of this, quite simply because we have to be aware of all of this. The consequences of increased stress are not only depression, anxiety, self-harm ideas, suicidal ideations. The consequences of increased stress are also increased substance abuse, faulty coping mechanisms, what we call as secondary trauma, where the immediate effect might not be related to that person, but an ignorance of the relationships might be there. There might be a problem with uh, the way you interact with your partner, the way you interact with your loved one, uh, invisible direct effects, which we have to acknowledge going forward. And this is crucial because as we go on and as the world returns to its normal pace, we might find it a little discordant to work with the same intensity while the world seems to have accepted and moved on. And this is something that I always keep on telling people when it comes to workplace mental health. But I can't stress about this enough when it comes to handling the stress in the hospital, because for us, work is the hospital. Uh, Remember that not everyone in your support group, in your family, will understand what you do. Not everyone in your society is going to appreciate how hard you work, or appreciate the stress levels or the trauma that is often associated with it, or the fact that the resilience you demonstrate is amazing and really ceases at no point in time to amaze us as mental health professionals, that how can a person be so resilient. It's never going to be something that a person from your non-work environment understands completely. Most of the time it is going to be your professional colleagues, your friends at your workplace, at the hospital, who will be able to understand and relate to the stress and worries that you're going through. So if there is any bit of anxiety, any angst, any worry, any of the symptoms that I've just mentioned that you feel creeping through, then remember, every person who works in your team, one rung above you and one rung below you, is going to be aware of what you're going through. And just having a talk with that workplace colleague, workplace friend, just having a conversation with the buddy that you have at your workplace, saying, "Ki, listen, um, I found it very difficult to try and cover up that part of my schedule," is going to help you a long way in easing your pressure, and is going to help you try and cope with things by just sharing about it with the people that you work with. You have to remember that when we talk about this, when we say this, i'm I know I'm addressing healthcare professionals. So I know that the buddy system isn't part of what we do. It's ingrained into us that if in doubt, we ask. We don't wait for approvals. We don't worry about what's going to happen. We inquire, we improve ourselves, and we ask for help, and we help in return. But many times we consciously forget to ask people how they are feeling. We consciously forget to have that conversation. Okay, listen, I might not feel up to going through the day. Uh, on that same note, many times, in fact, you would actually ignore how your colleague is feeling. If you are aware of this, most of us will become aware that the person that you're working with on a daily basis is not feeling up to it, is not feeling the same motivation that he or she was earlier. And that becomes obvious. And if that is something that you are noticing, you should have a conversation with them. A snitch in time saves the mind is something you have to remember. One conversation, one hi, one hello, one okay, I'm not I'm sensing that you are going through a tough time, is going to be so helpful to a person who is going through a problem, who is going through a crisis, that usually all that is required is an intervention at that point of time. So remember the buddy system, remember that it works, remember that we have been trained to use it. It is just that more often than not, we tend to use it for our day to day concerns about our patients. But like this year's theme goes, we have to learn to turn it towards ourselves. We have to learn to turn the lens on ourselves, and we have to learn to ask for the help, or make the other person aware of the help whenever possible. That's the buddy system. We've till now discussed depression, anxiety, substance abuse. We've discussed the possibility of trauma. We've discussed the reason for buddy systems being in place. Let's just talk about one simple thing which tends to get taken higher toll on the mental health, and that is, how do we keep ourselves focused? How do we keep ourselves engrossed in the daily activities? Well, small suggestions include breaking things into tangible pieces that you can work with. You don't have to worry about the entire month at a time. You don't have to worry about the entire week at a time. You can focus on the next 1 to 2 hours, and you break them into small modules, controllable time units, and focus on that. If I am absolutely focused, absolutely mindful about the next 2 hours, then I'm not going to be worried or scared about the entire implications. And that allows me to remain focused, to have the attention that is required, to have the focus that is necessary to get through the day in, day out. The second thing that I have always stressed upon, and I should repeat this again here, is have mindfulness as a part of your routine. Do a relaxation exercise just before you start the day for about a couple of minutes, and just about the time that you end the day, when you reach home. Most of us anyways have to go through a de-scrubbing routine by the time we get home and before we get to work. It takes around 15 to 20 minutes if you go about it very quickly. You can use that time to completely segregate your work worries from your home worries. And that two slots of times are essential, because this is the time, if you are not aware, that will allow the worries to filter through and cause anxiety throughout the day. So just a mindfulness exercise, a mindfulness routine, it could be mindful breathing, it could be a 5 sense relaxation exercise, it could be a simple mindful shower, or mindful eating technique. These are easily searchable things. These are easy resources to find. If you do that for 2 minutes, if you just do a normal breathing exercise for 2 minutes at the start of your workday and at the end of your workday, and detach yourself and maintain the work life balance, that is more than sufficient to ensure that you are able to focus, and you are able to focus on whatever challenge comes up to you. Now, just to make you aware of the resources that we have, we are a group of hospitals which has not shut down during the pandemic. No matter how demanding the situation, we have always remained running. We have always remained open. So I hope you all feel as proud of it as I do. But more than that, remember that what that also means is that we have the resources required. Like I told you, we have an psychologist at every unit, more than a couple of them, in fact, at some. We have a clinical psychologist, we have psychiatrists. Reach out to any of these, and we'll be happy to help you. The group, the Department of Mental Health Sciences, Mental and Behavioral Sciences, around 6 to 9 months back, came out with a toolkit for healthcare providers. You can reach out to your seniors, your marketing teams or your management teams, and you will find this small PDF which goes as a toolkit for healthcare workers. A toolkit for doctors. Small toolkit on how to maintain your mental health. Wonderful toolkit which was launched from Delhi. As in part of the Department of Mental Health Behavioral Sciences initiative, but is available to each and every one of us. And all you have to do is ask um, the marketing team or ask your counseling psychologist at that place to forward that PDF to you, and we'll be happy to help. And it shows these all these activities that I'm talking about, all these mindfulness activities, all the health check-ins, just a small conversation of 2 to 3 minutes in the morning with your team about, hey, I am feeling great. I need to know how you guys are feeling and how you're responding. Just a small health check-in, a mental health check-in for 2 to 3 minutes would help you get through this. And all of this is listed in the toolkit that was launched around 6 to 9 months back. So you can take help of it. Um, there is, of course, the usual sleep hygiene routine that I keep telling people, and that I found to be very effective with my clients and patients. So allow me to share this a bit with you. Usual sleep hygiene involves simple rules. So first is, if you're not sleeping at night, do not sleep in the afternoon. Second is, limit the amount of coffee intake to not more than 1 to 2 cups, and definitely not black coffee, please. And if you're going to do that, limit it to 4 hours prior to your sleep, or at least 2 hours prior to your shift ending. That ensures that you are not activated and you're not unnecessarily um, awake because of the stimulant effects of coffee or tea that you're taking. So you need to learn to tide that over. If you're going to go to sleep, ensure that your bed is meant only for sleeping, and it's all its connotations, and ensure that you don't watch OTT platforms or WhatsApp uh, on your bed. I mean, if you're watching WhatsApp, please switch off the last scene. More sleep has been lost because people are worried whether the message has been seen or no than actually what has been written in the message. So it's a great idea to try and limit the gadget use, try and get detox routines in. But if you're having sleep disturbances, definitely switch off the gadgets post 11 o'clock in the night. In fact, a good idea is to try and limit the Wi-Fi use. Just switch off the Wi-Fi and automatically things regulate if it's possible. Um, there is, however, one routine which I have found very effective during the pandemic, and that is because most of us have had to work through, but we've not had as much of exertion because initially there was not so much traffic, and we could save that hour or 2 hours. So what happened was, many of us found that we were not able to fall asleep on time. So one thing which you can do to ensure that you are able to maintain your sleep hygiene and you are able to regulate your sleep cycle is to see to it that no matter what happens, you wake up on time. See, earlier the rule was simple enough: early to bed, early to rise makes the man healthy, wealthy, and wise. But the problem is, during the pandemic, with the changing norms, with the changing routines, uh, we might not actually be able to get that 8 to 10 hours of sleep. So what you can do is, you can get whatever sleep you can, Trust your circadian system to catch up with the sleep when it will, and ensure that you wake up on time. 7:30 or 7:30 is usually the time that you wake up, and ensure that you have prepared the tea, prepared the breakfast for your family, and make breakfast the most important meal of the day. This simple routine will ensure that your anxiety about the day and your motivation about the day reduces. Basically, because if you can discuss with your family members what they're going to do for the rest of the day, what they're up to for the rest of the day, that keeps you motivated also. Remember that official, and this is, I think, WHO saying this around year and a half back, that it is the infodemic which was worse than the effects of the pandemic at that point of time. What they meant was that unfiltered misinformation, and unregulated information which was not up to the mark from uh, unscrutinized sources was probably more deleterious than the actual efforts. So, whenever possible, check in with your seniors, check in with your colleagues. We are a part of a group, so you will have uh, people who are experts in those situations. You will have people who are experts in those interventions who will be able to help you no matter what the situation is. But keep yourself updated, keep yourself abreast of what's new, what is challenging. And if you have a doubt, ask your seniors, ask your colleagues. Which brings me to an important point. You have to remember that earlier on, for almost a month, there was a little bit of stigma attached with being a healthcare professional. Luckily, we had good governmental initiatives which ensured that that stigma didn't become persistent. But if any one of you do face that issue, reach out to your managing team, and you will always have some person there who will be tasked with ensuring that you don't have to go through that stigma. So if you're facing stigma as a part of being a healthcare professional, you can just reach out, and you will have people who are ready to help. It's something that has been um, aware we are becoming aware of, we are working towards, and we have stringent rules and laws against that stigma. So if you are experiencing that, please reach out and let us know. uh, Finally, remember mindful exercises, remember CBT exercises. Like I said, we have toolkit for healthcare workers, mental health toolkit for healthcare workers launched. We also have actually a helpline which runs 24/7, which is run out of Delhi, but actually is managed by all the counseling and clinical psychologists across India. What it means is it's a toll free number, it's a confidential number, and more importantly, it is in the language that you would prefer it to. The rough count was 14 languages, but what basically ensures is that no matter which language you call in, there'll always be someone whom you can talk with. So the number is 837-680-4102. You have the references of this helpline with your management teams, with your the marketing teams. There is all your counseling psychologists are also aware of this. So reach out to the stress helpline if you feel um, things are becoming overwhelming or things are becoming overtasking. Remember that we are healthcare workers, and we have stood through one of the most toughest times that any one of us has ever faced. The last such pandemic was almost 100 years back. No one really is around to tell us how it was like. But in the past 2 years, every single one of you has been in the front line and has stood firm to ensure that what was once a pandemic uh, and a nightmare is now a much more manageable illness which we are coming to terms with and living with. So, congratulations on that. But if you at any point of time here or in the future feel overwhelmed, remember that we are there, we are aware of this. And if you talk with us, if you reach out to us, we'll be more than willing and happy to help. You're not alone in this fight. You never have been, you never will be. You have your colleagues, you have your seniors, you have your teachers, you have your um, department heads, you have your professionals, you have other colleagues and friends at workplace who have stood by you. So remember, if in doubt, please reach out and ask for help. Uh, Not only about yourself. If you find that even someone from your house feels the stress, feels the worries, do reach out. We'll be happy to help. If there are any questions, I'll take them now. Otherwise, thank you for listening to me on what is holy. Uh, it's an holiday in some parts. It's an optional holiday in some places. That just tells you something about our profession, doesn't it? And that is that we really do not know uh, any time or place where we step down our level of vigilance and our level of action. It doesn't matter to us whether it's Diwali, it's New Year's, or it's Holi, or tomorrow is Dhulwad at some places. I think Bombay is going to um, get the burnt of it when it comes to Dhulwad. But um, all of all of us are here working together, even on a holiday. And remember, you are not alone. You are with colleagues, you are with friends who understand the sacrifices that you have made, the pressure that you are in. So please reach out. We'll be happy to help. Thank you all once again from the bottom of my heart. And yes, do remember in the night to have a little bit of gratitude for the fact that even though all of us have weathered this storm together and we are here, the experience has not been the same for everybody. We're thankful that we are here together. And if required, we are here for our colleagues. But yes, some amount of gratitude, not only for your colleagues, not only for your loved ones, not only for God for keeping us all safe, but more importantly for yourself, for you as a person, for making it through the most tough time that the world has known in the recent years and coming out of it in the best way possible as a frontline healthcare worker. Thank you all for being there, and do reach out if you think we can help in any possible way. Thank you, guys.